If I'm thinking about a Chamber of Commerce Man of the Year award, I'm thinking about recognizing somebody who has brought incredible value to a community.
I feel like he is a shining light in healthcare in Santa Cruz County. I'm really proud to be a colleague of his.
Larry takes this community, our commitment to the community, very seriously.
He has this kind of calm, understated, intelligent way of leading.
Larry was a very important leader in working at the federal level to get Medicare payments updated for today's reality of cost of practice.
So why Medicare? What's it do? Medicare pays hospitals and doctors differently. What I discovered in 2001 was that when Medicare drew the map for California, they divided each county up into its separate unit for hospitals, but they were a little bit lazier on the physician map, and they figured Santa Clara, San Francisco, Los Angeles, those are urban counties. The rest, pretty much, they're rural.
So Medicare payments to doctors were low, as if we were all living out in the country with rural cost of living.
We suddenly found that this was affecting our ability to bring young docs to Santa Cruz to care for your grandma, my mother, or any senior over 65.
Undeterred by the glacial speed that legislation moves at, he persisted and persisted, and now it will come to fruition.
Payments to local doctors for Medicare will begin to improve in 2017 and get better each year.
And there will be meaningful change for every single doctor in the county. And what that means is that patients with commercial Medicare will be seen by any doctor because the reimbursement is such that they can afford to see them. In many counties, as you know, Medicare patients really have to hunt to find a doctor, and he's fixed that.
We were 55 doctors when I took over this job. We're 210 in this organization. Lots of young physicians and staff have come here to make their careers. So we have now, I think, a sustainable model where we're getting these incredibly talented young docs to come here and they make their careers here.
Superman Larry, congratulations, Dr. D.
I don't think people understand just how difficult this was to get done. I mean, I've worked on a lot of legislation in the past, big bills like Americans with Disabilities Act, campaign finance reform, but none of them took 14 years to do.
It was a remarkable journey on your part and a success, a great success.
The doctors in Santa Cruz and all of California have you to thank. The seniors in California have you to thank, and Congressman and I have you to thank as well. Congratulations, you deserve it.
You caused a very kind of historical moment there, and it took us many more years, but it's now done, and probably about $20 million into the Central Coast of Monterey, Santa Cruz, and San Benito County in additional doc payments because of you.
I have to thank two people. My big brother sued the Medicare program. He brought the case before the Supreme Court and lost it there. But he made so much noise that it was part of the reason why Congress acted. The other person is my wife, I have to thank, because this is ironic. The most powerful tool that convinced Congress and the Medicare program they had a problem was Excel, Microsoft Excel. And it as a program enabled me to show the financial impact that the Medicare program had on patients. And it was my wife that taught me how to be a master at Excel.